I'm hoping to talk about what is anxiety, how it presents, the predisposing factors, risk factors that we know, a brief discussion about anxiety disorders and treatment, but I'm not going to go into any detail about treatment. I'll just mention what they are, because we've got Professor Bazir here, the expert. Can't beat that, so I'll leave that to him. And I'm also going to talk about, actually I've put what anxiety sufferers would like their families to know and friends to know. I've brought that a bit forward, so I'm going to mention that. I got it from the internet, so. So basically, I thought this was quite interesting. It was written by a freelance writer called Eileen Bailey in Health Guide in November 2012. And basically, anxiety sufferers were trying to say, you may not understand anxiety, but it does exist. And that the sufferers do feel embarrassed that they can't do what others can do, especially when they're anxious. They also said they don't like feeling how they are feeling when they're extremely anxious. And sometimes we look at people who are suffering and think, it's just using that as an excuse. And they've said, it's not an excuse, I'm really suffering. And some of the people who are suffering also said, well, yes, they acknowledge that some of their fears might appear irrational, but that's where they are at that point in their lives. And they also said, it's okay if you don't know what to do when I'm in that state. Just be there and let me know you're there for me. So I thought, well, I hope by talking through what anxiety is and seeing what treatments and seeing what we can do to help, perhaps I might address some of these things that anxiety sufferers have talked about. So I'll start with the definitions that we know we have for anxiety. The Oxford English Dictionary defines anxiety as a feeling of worry, nervousness, unease about something with an uncertain outcome. And I was a little bit anxious coming up to talk. So I've had to sort of calm down and sort of looked around and thought, oh, friendly faces, it might not be so bad. So everybody feels anxious. And of course, there are various, all the definitions come to the fact that it's an unpleasant feeling and a sense of apprehension because you just don't know what. And what it does is that then the nervous system, the one we call the autonomic nervous system in the body, the sympathetic bit of it, there are two sides of it, but the sympathetic bit of it kicks in. And that's what makes us get the headaches, the tightness in the chest, the palpitation and the abdominal discomfort. That's how all that comes about. But anxiety might just be a necessary warning sign of danger or a difficult situation or how we perceive it. And sometimes it can just help us to anticipate difficulties or challenges that lie in wait and helps us to prepare in advance. And it's felt that anxiety can actually be helpful and adaptive when it's normal. Because quite often, it's little things like people get anxious when they're doing something for the first time, getting in the car to drive, the first time you ride a bicycle, first date, first day going to work, or just first time of anything, but it's not necessarily bad, or even preparing for an occasion, So that little bit of anxiety might just help you to do the things you need to do and prepare. That could be normal. But when it then carries on, and then people also say that, is anxiety different from fear? In a way, anxiety looks at fear is a bit about the here and now. You get those sort of feelings of apprehension, what is happening now. Anxiety is looking ahead. What will happen? What's going to happen? And so, in a way, fear can fuel anxiety, because both can be adaptive as long as it's under control. But what then happens when anxiety becomes a problem? It becomes abnormal when it's persistent, when it just never goes away. And when anxiety begins to turn into irrational thoughts, distorted thoughts, and interferes with functioning, when everything becomes really difficult, like your social life, your work, family life, when anxiety starts disturbing all that, then it has become problematic. And if it's not addressed, it can become an anxiety disorder. So over a period of time, if anxiety is not addressed, then it then becomes a problem, a huge problem on its own. And some of the anxiety disorders that the common ones are generalized anxiety disorder, panic attacks or panic disorder, specific phobias, social phobia, obsessive compulsive disorder, and I'm going to talk a little bit about these as I go through the slides. And we've also got post-traumatic stress syndrome, disorder, not syndrome. So, the pattern of distribution of anxiety in the population is thought that as at 2007, about almost 2.3 million people in the country were suffering from anxiety. And it is believed that by 2026, this will rise to just under 2.6. So the belief is that, from our researchers, is that anxiety is increasing. And that's a bit of a worry. We want a world where things can get better rather than worse. And I suppose if we can sort of dent this projection by listening and doing something to stop anxiety being worse or becoming more of a problem, I think this session would have been a good session. Because it's good to plan. In a way, the researchers are a bit anxious. They're thinking, from our projection, it's going to get worse. So they are thinking. So, and this is the opportunity to then say, well, what can we do about it and get something done? And interestingly enough, anxiety is the most prevalent mental health problem. It's many people think it's depression. It's commoner than depression, actually. And sometimes they coexist. But in terms of numbers, anxiety occurs more commonly. And it tends to affect women more than men, almost twice as much. And tends to run in families. As I mentioned earlier, it could be a comorbidity to other psychiatric conditions like depression, substance misuse, personality disorder, and psychosis. And some people with anxiety just present with physical symptoms because they believe it's physical, so they go to the doctor presenting as a physical problem. But what's really interesting is that, and perhaps that could be why we expect more people to show up with anxiety. At least half of the people suffering with anxiety disorders are not in contact with services of any sort. And of course, if they're not in contact, they're not going to get any treatment. And almost half of those receiving treatment do not receive medication or psychological therapy. The reasons for that I've been looking for, but I don't know. Is it access to services? Is it refusal to have treatment? I'm going to look further into that, but that's the number that I got. It's also interesting that married people have lower prevalence of anxiety than the widowed, divorced or unmarried. And it seems that it's the loss of a relationship or not having a relationship that seems to be a real risk factor in being more anxious. Studies out there also suggest that low levels of education and low income have a high correlation with developing anxiety, as well as unemployment seems to be a risk factor or predisposing factor as well. And it's also thought that the predisposition to developing anxiety starts from childhood. That, for instance, how a child responds when they're young to new situations might suggest that they might develop anxiety when they're older. For instance, a child who sees a new thing and sort of runs away, clings to mum, cries, might suggest that they're just a bit apprehensive, and that's a sort of avoidance. I've mentioned that it could be familial or genetic, and it's also thought that children that are neglected or experience violence in early life tend to develop anxiety as well, or parental rejection, and on the other side as well, being overprotective, particularly in people who develop social phobia, overprotection. So it's about getting that balance right, and I think it's, in my view, we just, parents have to keep working at it, because it's about knowing the dynamics of the real world we live in. 20 years ago, you could leave a young child to just ride the bike in the garden. Now you sort of have to keep watching. So the balance of, depending on where you live and how you live, of allowing the children to grow up freely and giving them the amount of protection they need. But I think that we work it out in groups, talking and living in a community. Other risk factors are things like exposure to trauma, serious incidents like accidents can make people anxious because they're wondering if it's going to happen again, or being in an aeroplane crash, surviving an aeroplane crash. I think that must be quite traumatic for anyone. Substance misuse like amphetamines, LSD, ecstasy also increase the chances of developing anxiety. I've mentioned other mental illnesses and chronic illnesses, thyroid diseases, or even any life-threatening disease predisposes people to anxiety. And so going back again, what you feel in normal anxiety is that you get this thing that's called a flight or fight response. That is normal. The body gets this release of chemicals into the blood, and usually adrenaline, through messages through the brain. And what happens is that, and anybody who's been anxious, and I think everyone in this room, would have experienced normal anxiety at least once. You find that your heart starts beating quite quickly. And that's because there's increase in blood flow to the heart, and also increase in blood supply to the brain. And that is because the body is preparing for a very difficult situation. There's also more blood to the muscles, and that's why you get all that muscle tension, aches and pains, and well, aches when the anxiety is over because of all the tension that builds up. But once the threat passes, or the stressful situation passes, you expect everything to go back to normal. So, it's supposed to be a physiological response. And that's how we have evolved to be able to run away from danger. But if we keep perceiving danger all the time, then it's ignorable. And like we said, all the physical symptoms of anxiety are things like sweating, skin looking a bit pale, dry mouth, tense muscles and pain, tremors, tingling in the fingers, and breathing quite fast. If we've ever been anxious, we might have experienced, maybe not all, but some of them. More symptoms, you can feel a bit dizzy and faint, a bit of heartburn, having to go to the little room quite often, and feeling a bit sick, tight in the tummy. And some people have to go frequently to move their bowels, which is uncomfortable. Well, maybe not uncomfortable, but having to go that often is not pleasant. And sometimes it looks like a physical illness when it isn't. And psychological symptoms of anxiety, that means the way we think and feel when all this is going on, is feeling worried all the time, feeling tired, not being able to concentrate, being quite irritable, not sleeping well, mood can be low, and therefore we might just mimic depression, but it could be anxiety that then, because it's persisting, is also causing low mood. And after a while, when it becomes a bit unbearable, some people begin to experience suicidal thoughts. And in terms of behavior, anxiety sufferers typically avoid situations that provoke anxiety. And how does this affect them socially? Because after a while, they begin to isolate themselves because they're afraid of leaving the house. And people notice a change in their personalities, and where family and friends or carers come in, is you begin to notice a change in the personality of whoever you're looking after. This can also result in relationship problems. And for things like OCD, the compulsive and repetitive behaviors can be quite disruptive as well to the life of the people around and also to the sufferer. And many people learn to cope using alcohol or substances. We know that that is not the ideal way to cope, but we do know that a lot of people with anxiety or other mental health problems do fall back on this sort of coping mechanism. And apart from all the other relationship problems, people could have problems at work and school just because of their anxiety. So, just a little bit about the various types of anxiety, but I'm not going to spend a lot of time on it. And the reason why I'm going to talk a little bit about each one is because even though they all sort of have the same similar final outcomes, as in the tremors, the sweating, and in terms of physical symptoms, it's also slightly different, and sometimes the sort of treatment you give each one in terms of the therapy might be slightly different. And that's why it's important that it's properly assessed, a decision is made about what type of anxiety it is, so that that person gets the right treatment. And that's what I'm just going to run through it very quickly. So in generalized anxiety disorder, it focuses on everyday events. These sufferers worry about anything and everything, and they worry all the time. And it's also interesting that some of the studies said that amongst anxiety sufferers, they are the ones who are likely to see their doctors, and they form almost a third of what the GP would see for anxiety. Because it's that disabling anyway, because they're worried all the time. And they're in a very high state of arousal and always think something terrible is going to happen. So, like all anxiety, it's like a step care approach is what's used. So there's always one step, where the first step where you do identify that there's a problem, do a full assessment and assess the degree of the distress and functional impairment. The next step is actually doing things like self-help interventions, and some of them are guided and some of them are facilitated, and then you could also have groups. And it's usually like CBT type of technique that's used in those. And I know that you've had a talk on CBT earlier on today. And the step 3 is proper CBT and relaxation techniques. And anxiety, it's particularly important that people learn the relaxation technique because that's particularly good. And breathing exercises for relaxing the muscles that become very tense. And at the 4th stage, when people are very, very anxious, very ill, can't cope, everything more or less stops, and they need more highly specialized treatment, a high level of psychological input, and in which case we use the multidisciplinary team in secondary care, and the use of the crisis team if required, and inpatient services if needed, to treat the patient, to make sure that they are safe and get them well as quickly as possible. Panic disorder is another anxiety disorder, and basically a panic disorder obviously starts from a panic attack. And this is basically, a panic attack is an abrupt experience of intense fear and discomfort and is accompanied by those physical symptoms I talked about earlier on, at least 4 of them, and could just happen out of the blue, totally unexpected. It could happen because of a situation or something that's seen. Some people don't like the sight of a needle or blood, and they panic when they see that. Or it could be that they know that if they see a needle, they might panic. So some of them is just, it might happen, it might not. But for some people, if they see a needle, they're out. They panic. And it tends to be quite sudden, and it's all over within about 10 minutes, that panic and all the physical symptoms that we talked about could happen. And a panic disorder is when you have a recurring pattern of panic attacks, and it could be with the fear of open spaces or crowds, or without. And the main fear tends to be the fear of losing control. Sometimes it's as severe as feeling that they're going to die, or losing their minds, or there's no help available. And for those 10 minutes when they're going through it, it must be very terrible. It must be a terrible thing to go through. And another type of anxiety disorder is a specific phobia. And this is a selective and persistent, out of proportion sort of reaction, which is excessive and unreasonable fear related to a specific object or situation. So for a lot of people have this fear of heights. For some people it's just even dogs, and some people it's snakes, and it's often associated with a panic attack. So once the threat is over and they're not near a height or anything like that, they're fine. And of course the thoughts could lead to a behavioral response. So they avoid heights, they avoid anywhere where they might meet an animal or meet whatever provokes their anxiety. And the treatment of specific phobia, and that's why I said it was necessary to talk about this individually very quickly, is that the sufferer will be taught to create a new learning history about these things are not dangerous. It is their perception, and a person that's trained to do that does it so that they relearn that what they perceive as a threat or danger perhaps is not as they think it is. Also, they need to learn relaxation, so they get exposed to that threat and then they're taught to relax so that it doesn't have the same effect on them. And the fear and avoidance hierarchy, subjective units of distress scale, those are just ways of measuring how much they respond to that specific phobia and knowing exactly where to match or approach the treatment. And social phobia is another one that actually why social phobia is quite important is that, first of all, it is the fear of having to do something in front of others. For instance, having to talk in front of you, I was a little bit anxious, but I managed to stand here and I'm shaking a little, but not that much. So there are various techniques that can be used to deal with that. Systematic desensitization, with or without relaxation training, flooding, modeling. I'm sure the psychologists would I've talked about all this. They're all sort of part of the CBT tree and ways of just managing. It's about it's a talking therapy kind of thing, and then intervention. Exposing people very slowly. If, for instance, they find that they don't like going out, you start taking them to the city very slowly and seeing how much of it they can manage, and then bring them out of the situation again, and then managing their anxiety and how they manage the situation, and then encourage them and say, we're going to do it again. It was difficult last time, but let's see if it's going to get better. So we're going to do it again, and then we keep doing it again and again and again, and see if it gets better, and it does get better. And of course, some people have used hypnosis as well. Medication, Dr. Bazet is here, but basically it's antidepressants, like I said earlier on. And the commonest ones that are used are the SSRIs, selective serotonin reuptake inhibitors, that's what's, and monoamine oxidase inhibitors, but the monoamine oxidase inhibitors are not used commonly, but in social phobia as a second line, if the first line doesn't work, can be. But I'll use that, can be used. I'll leave that to Dr. Bazet. I'm sure a lot of us have heard about OCD, and that's obsessive compulsive disorder. It's also classified as an anxiety disorder. And that's because, and it's characterized by obsessions. That's, even the patients suffering from it know that it's a nonsensical thought. They actually know that the thought is their own. They think it's nonsense, but they can't help it. And sometimes it's images, urges that the individual tries to eliminate, and then they have these rituals they have to do to suppress the thought and provide some relief from the anxiety. But it gets a bit tiring, especially those who worry about germs, so they're always washing their hands. And if they touch anything, they will wash, and sometimes it takes over their lives. And also, even hoarding. Hoarding can be a type of OCD, and hoarding can be distressing to the extent that it takes over people's lives, such that they are now stuck on a little chair in a big room, because and they build a little tent because they have to put things all over them, and life becomes really difficult. And for people looking from outside, we might not understand it, but like that little note said earlier on, let's go into their world and understand what they're going through so that we can help them. Right, and there are various steps as well for treating OCD, and the main thing is that the information gathering, that's important, history taking, that's where we start from. Then we do the exposure and response prevention, expose them and prevent them from washing their hands, if that's hand washing, or prevent them from buying anything else or bringing anything else into the house. Stage 3, we could ask patients to do some homework, to expose themselves to some anxiety-provoking situations. Don't wash your hands and write what happened in a little book. But they just need to have a facilitator that's very encouraging and helping them through the difficult situation. And medical aspect as well, SSRIs, and again, we're going to hear a lot about that. Now then, the social aspect of treatment, because like in mental health, we go biological means, that's the medication, psychological, and I've talked a bit about that, the CBT, this, and other things that you can do. We're going to hear a bit about the mindfulness later on. But the social aspect is also very important, and that's where friends, families, and carers come in. As I said in my opening statement, what the sufferers wanted their carers and friends and families to know, if we can take that on board, the main thing from that was they wanted support and understanding. To know that yes, they are suffering, but what they need is just a bit of understanding. To show them that we're there for them. To show them that, give them hope that they can get better. And we're going to walk through them, walk with them, not walk through them, walk with them right through it. Ensure that they eat well, healthy, balanced diet. Reduce caffeine. Dr. Bazet has said he's going to add something about caffeine into that. Alcohol in moderation, I think we've talked about that as well. Stopping smoking, and there are smoking cessation programs all over the place, so they help. But stopping smoking would also help. And yes, there are herbal remedies that are out there in the literature that help, but in terms of the NICE guidelines, there is no support for the doctor to prescribe them or the mental health practitioner to prescribe them at the moment. So if you do decide to do herbal remedies, you must discuss with the doctor because of a possible interaction with other medications. So it mustn't be used without advice. But in terms of the NHS prescribing it, it can't be because it's not recommended as evidence-based treatment. Right. The other bit is help the sufferer to seek help early. If they're not motivated enough to do it themselves, encourage them. Help them to get to the doctor so that they can be referred, or if they don't want to see a doctor, they might start with other agencies in the community, and there are lots of them that can be accessed to get some help, and then perhaps from talking to somebody, maybe independent or outside the family, they might be encouraged to get to the doctor. Because early treatment, there's no point suffering for a long time for the kind of thing people go through when they're anxious. I'm quite aware that I'm running out of time, so I'm going to sort of move quickly. So it's just, I'm now on the summary. So yes, anxiety disorders are common. And I've already said that it's those who have generalized anxiety disorder that tend to see their doctors often. We've talked about women suffering more than men, except in OCD, where the distribution appears to be equal. That's interesting. And almost 1 in 5 people feel anxious all the time. And, well, I thought everybody has been anxious at least once, but the literature says about 1 in 20 people have never been anxious about anything. That's interesting. And it also says that people in their middle years, 35 to 59, report the highest levels of anxiety compared to other age groups. People in older age groups tend to be less anxious, but they are more likely to be anxious, that's the older age group now, about getting old, or the death of a loved one, or their own death, their own mortality. So that's interesting. People with a disability, on the average, are thought to be more anxious than those without disability. I've talked about unemployment, that they also tend to have more anxiety levels. I've talked about the low income. And women and young adults aged 20 to 29 are more likely to seek help for their anxiety. That's interesting. Than other people. And financial issues are a cause of anxiety for half of the people, but this is less likely to be so in older people. And women and older people are more likely to be anxious over their loved ones. And it says 4 in every 10 of employed people experience anxiety about their work because they're worried about being made redundant or becoming unemployed. And younger people tend to be anxious about relationships. And like I said earlier on, fewer than about 1 in 10 have sought help for their anxiety. So we need to do more to get people well. Encourage them to go. Those who are unemployed are more likely to use coping strategies such as that are harmful, like alcohol or cigarettes. We have talked about reducing alcohol or taking alcohol in moderation. Not reducing can be, some people might say, oh, they've said reduce, so they take 20 units, oh, I'll reduce it to 10. No. It has to be a sensible use of alcohol within the required national, and if people need help, there's help out there. So if you know a sufferer, you could encourage them to go to the, well, in this area it's called the Norfolk Recovery Partnership, to seek help if they're having problems with their drinking. And of course, smoking cessation, we can do that as well. Right, so I'll just close with seek help. If you're a service user and you're suffering from anxiety, seek help. If you're a family member or carer, help your family member or want to seek help. GP is the usual first port of call and the best person who can help you to access services. Family, friends and carers have a very important role in early detection and intervention. So please encourage people to seek help. And there are so many self-help groups there, many agencies, like so many who've come here to show the display. Everyone, there are so many out there that can help and support. So do make use of them.